Hi there. A lot of folks think that Stevens-Johnson syndrome is merely a skin disease and something that needs to be treated. However, SJS can also cause blindness if it is left untreated. SJS is an adverse reaction that folks have to certain medications. Sadly, it is common in a lot of routine medications such as antibiotics, anti-gout medications, and even anti-seizure medications. When SJS starts to form, it creates a rash, and then eventually it starts to blister, and then eventually it starts to peel the skin off. The immediate treatment is really to stop the medication that the patient is actually on and then treat the skin wounds itself. However, if left untreated, SJS can also lead to blindness. What ends up happening is the eye layer, the first eye layer called the epithelium, starts to get damaged just in the same way that a skin cell starts to get damaged. That scar tissue will then eat away at the epithelial layer, and thus causing scarring, which will prevent the patient from actually seeing out of that particular eye. Therefore, an ophthalmologist needs to be seen immediately so that he or she can actually treat the underlying issue of SJS in the eye region. If you or a loved one suffers from blindness and it's due to a Stevens-Johnson syndrome that was not treated by an ophthalmologist, then you may very well have a medical malpractice claim. My name is Adam Funk, and I am a medical malpractice lawyer that I would be happy to chat with you about your potential claim. You can email us, you can text us, you can call us, and we will schedule an appointment with me, an attorney, to speak to you immediately.